Welcome to the breastfeeding promotion and support in a baby-friendly hospital. Session 15, Making Your Hospital Baby-Friendly. Objectives for this session: explain what baby-friendly practices mean. Describe the process of baby-friendly hospital initiative assessment. Describe how baby-friendly hospital initiative can be included in existing programs. What baby-friendly practices mean. The aim of this course is that every staff will confidently support mothers with early and exclusive breastfeeding, and that this facility moves towards achieving baby-friendly designation. A baby-friendly hospital implements the 10 steps to successful breastfeeding, accepts no free supplies or samples, and no promotional material from companies that manufacture or distribute breast milk substitutes, foster optimal feeding, and care for those infants that are not breastfed. Step 1. Have a written breastfeeding policy that is routinely communicated to all healthcare staff. A policy defines what the staff and service are required to do as their routine practice and should be mandatory. To satisfy the requirements of the Breastfeeding Hospital Initiative, a policy has to cover all the 10 steps, as well as prohibiting free supplies of breast milk substitutes, bottles and teats, and promotional materials. In high HIV areas, the policy must clearly define what the staff and services are required to do, as the routine practice is related to mothers who are not breastfeeding. Step 2. Train all healthcare staff in skills necessary to implement this policy. If staff are used to working in a facility that does not use baby-friendly practices, they will need training to learn about these practices. Knowledgeable staff together can make the necessary changes, eliminate unsupported practices, and develop baby-friendly practices that assist mothers and babies to breastfeed. Step 3. Inform all pregnant women about the benefits and management of breastfeeding. Pregnant women need accurate information that does not promote commercial products such as infant formula. This information should be relevant to specific women. Step 4. Help mothers initiate breastfeeding within a half hour after birth. Place babies in skin-to-skin contact with their mothers immediately following birth for at least 1 hour, and encourage mothers to recognize when their babies are ready to breastfeed, offering help if needed. Skin-to-skin contact helps to keep warm and to stabilize breathing and heart rate. Breastfeeding to get started, baby and mother to get to know each other. The baby or mother need immediate medical care at birth. This skin-to-skin contact can start as soon as they are stable. Step 5. Show mothers how to breastfeed and how to maintain lactation even if they should be separated from their infants. Some mothers have seen little breastfeeding among their family and friends. Showing them some main points can help breastfeeding to go well. The baby's body needs to be in line with ear, shoulder, and hip in a straight line so that the neck is neither twisted nor bent forward or far back. Close to the mother's body so the baby is brought to the breast rather than the breast taken to the baby. Supported at the head and shoulders, and if newborn, the whole body should be supported. Facing the breast with the baby's nose to the nipple as she or he comes to the breast. Signs of good attachment are chin touching the breast or near the sole, Mouth wide open, lower lip turned outwards, areola more visible above than below the mouth. Signs of effective suckling are slow, deep sucks and swallowing sounds, cheeks full and not drawn in, baby feeds calmly, baby finishes feed by him or herself and seems satisfied, mother feels no pain. The mother needs to know what kind of replacement feeding is acceptable, feasible, affordable, sustainable, and safe in her situation. How to obtain, prepare, and feed the replacement feeds safely. Step 6. Give newborn infants no food or drink other than breast milk, unless medically indicated. Breast milk coats the body system like a paint to protect it. Other fluids or foods can wash away this protection or introduce infections to the baby. Step 7. Practice rooming in. Allows mothers and infants to remain together 24 hours a day. Step 8. Encourage breastfeeding on demand. Rooming in helps a mother to learn the feeding cues of her baby and how to care for her baby. Step 9. Give no artificial teats or pacifiers, also called dummies or suitors, to breastfeeding infants. The use of artificial teats or pacifiers may interfere with the baby learning to breastfeed, affect milk production, indicate the mother or health worker finds it hard to care for the baby and needs assistance. Step 6. Step 10. Foster the establishment of breastfeeding support groups and refer mothers to them on discharge from the hospital or clinic. Support for breastfeeding and other aspects of caring for a baby will be available from family and friends, health workers, organized support groups, and counselors, informal or volunteer support groups and counselors, and other community services. Hospitals must abide by international code and subsequent resolutions in order to be recognized as baby-friendly. The overall aim of the International Code of Marketing of Breast Milk Substitute is the safe and adequate nutrition of all infants. To achieve this aim, we must protect, promote, and support breastfeeding. Ensure that the breast milk substitutes are used properly when they are necessary. Provide adequate nutrition about infant feeding. Prohibit the advertising of or any form of promotion of breast milk substitutes. Report breaches of the code to the authorities. The process of baby-friendly assessment. First is self-appraisal. The baby-friendly hospital initiative process begins when the hospital decides to make changes and forms a group of committee with a coordinator to take responsibility. The committee arranges for 2 to 3 people to use the self-appraisal tool to review their policies and practices that may help or hinder breastfeeding. The yes/no boxes in the form should be filled in honestly to a normal day. Once the hospital can see which of its practices are supported and which are not, it can make a plan of action that lead to service that is more supportive. Second one is the external assessment. After the self-appraisal is completed, the committees have to work to help other staff to make the necessary changes. When the changes are satisfactory, the National Baby-Friendly Authority can carry out an external assessment using the global criteria. A multidisciplinary assessment team visits the maternity services and interviews staff and mothers, observes practices, and reviews documentation. Interviews with pregnant women and new mothers are key to the assessment. The national authorities determine if the hospital will be awarded baby-friendly designation. Ongoing monitoring. When a hospital is awarded baby-friendly status, it is required to maintain the standards of the global criteria and to abide by the international code to remain designated as a baby-friendly hospital. External reassessment. It is also important that hospitals that have been designated baby-friendly be reassessed on a regular basis to help ensure that they maintain their adherence to the 10 steps in the code over time. UNICEF recommends that hospitals be reassessed approximately every 3 years. Reassessment should be conducted by an external team. Once reassessed, hospital status as baby-friendly can be renewed, including the baby-friendly hospital initiatives in existing programs. Some hospitals participate in national or international accreditation process, quality assurance or improvement program that identifies equity of access, quality of service, and accountability as approach. The Baby-Friendly Hospital Initiative can fit into these quality assurance programs. It has measurable criteria and international standards. In a hospital, Baby-Friendly Hospital Initiative may be responsibility of the Mother and Child Services, a breastfeeding or infant feeding committee, or it may be part of a quality committee. The expertise of staff in the maternity services is usually in the care of mother and baby. The BFHI can be integrated with Safe Motherhood and/or IMCI programs. Session 15 Summary. The Baby-Friendly Hospital Initiative self-appraisal helps a health facility to see what practices are in place and what areas need attention. A structured plan for improvement can assist change. External assessment is requested when supportive practices are fully in place. Ongoing monitoring and reassessment are needed to keep standards high. The FHI can be integrated into other programs, such as a hospital quality improvement program if one exists.